Consider these facts. 1 in 4 adults in the United States experiences a mental health concern every single year. Mental illness causes more lost days of work than physical ailments such as arthritis, asthma, back pain, diabetes, hypertension, and even heart disease. And while emotional distress does not always mean a mental illness exists, it can still take a major toll on employee well-being, not to mention performance and productivity. In the end, everyone suffers when mental illness is left unaddressed in the workplace. Fortunately, organizations can take steps to create a supportive environment, or what is referred to by the American Psychological Association as a psychologically healthy workplace. Taking these basic steps not only helps employees in distress, it can increase employee resilience, engagement, and retention, as well as productivity. By building a psychologically healthy workplace, every organization can protect its most valuable asset, its employees. Just as organizations have begun paying more attention to the physical health of their employees, many are taking steps to maintain the mental health of their workforce as well. Positive mental health allows people to work more productively, reach their fullest potential, cope with the everyday stresses of life, and make meaningful contributions to their communities and their workplaces. In addition, workplaces that foster an attitude of support for employees who are struggling with mental health concerns can benefit in the following ways: reduced turnover, training, and recruitment costs, attracting talented people that appreciate a workplace that supports mental health, reduced sick leave, as employees are encouraged to address their mental health concerns before they become unmanageable, enhanced relationships in which employees feel supported by others at work, and improved productivity as engaged employees perform at their best when they know their employer cares. Mental illness is very common. In fact, 1 in 4 Americans experiences a mental health issue every single year. In addition, according to the National Alliance of Mental Illness, 18.1% of adults in the U.S., or over 42 million, experienced an anxiety disorder such as generalized anxiety, post-traumatic stress disorder, obsessive-compulsive disorder, or specific phobias. 6.9% of adults in the U.S., or roughly 16 million, had at least one major depressive episode. Approximately 1 in 25 adults in the U.S., nearly 10 million, or 4.2% of the population, experiences a serious mental illness in a given year that substantially interferes with or limits one or more major life activities, such as their ability to work productively. And unfortunately, less than half, only 41% of adults in the U.S. with a mental health condition, receive any mental health services to treat their condition. For most, a combination of stigma and real or perceived barriers